Okay, guys, let us start our today's topic. So we are discussing about infectious diseases. So first we discussed is about AIDS. Now today we are going to discuss about another infectious disease that is hepatitis B. So first we will see what is the causative agent of this hepatitis B. Causative agent. This hepatitis B it is caused by viruses known as hepatnaviruses. It is caused by a virus belonging to group hepatnaviruses. That virus is known as HBV. HBV. Hepatitis B virus. Hepatitis B virus. So this hepatitis B virus, it belongs to a group of viruses. Those viruses are known as hepatnaviruses. Actually, it is the word hepa, Hepa, hepa. Hepa pertains to liver, hepatic. Hepa pertains to hepatic. Hepatic pertains to liver. So they are the viruses which attack liver. These viruses, they are DNA viruses. So hepatitis B virus is a virus which belongs to a group of viruses known as hepatnaviruses. So actually the word hepa refers to hepatic means to liver, hepatic pertains to liver. So these are a group of DNA viruses which attack liver, right? So hepatitis B virus, it is a member of these viruses, right? So it is caused is the hepatitis B, it is caused by infection by a virus known as hepatitis B virus. So hepatitis B virus is the causative agent of hepatitis B. Now we will see how the infection occurs. Mode of infection. How we get this infection? This hepatitis B, it is a sexually transmitted disease. It is an STD. Hepatitis B is an STD, sexually transmitted disease, like AIDS. And like AIDS, it also is transmitted from an uninfected person to an uninfected person through through exchange of body fluids, and through unprotected sexual intercourse. Unprotected sexual intercourse between an infected person and a normal person. Whenever there is an unprotected sexual intercourse between an infected person and a normal person, this hepatitis B it spreads from infected person to a normal person through unprotected sexual intercourse. So it is a sexually transmitted disease. And like AIDS, it also is transmitted from infected person to a normal person through exchange of body fluids. If there is exchange of unchecked blood, if there is unchecked blood transfusion between a hepatitis B patient and a normal person, the normal person will get hepatitis B, right? So, like AIDS, it spreads from infected person to uninfected person through unchecked blood transfusion, through unchecked organ transplantation, through unchecked artificial insemination. Like HIV, like AIDS, it spreads from an infected person to a normal person by sharing of hypodermic needles and syringes. So it in many features, in many aspects, it resembles with the AIDS in its mode of infection. So it is a sexually transmitted disease, and it also is transmitted from an infected person to a normal person through unchecked exchange of body fluids. It may be transfusion of blood, it may be transplantation of organs, or it may be through artificial insemination, or it may be through sharing of those hypodermic needles and syringes, right? So it is an STD, sexually transmitted disease. What about its incubation period? Incubation period for hepatitis B is 20 to 35 days. I have told you what is incubation period. Incubation period is the time from the entry of pathogen into the body till the manifestation of first symptoms, right? So it takes some 20 to 35 days for the virus to develop the first symptoms. Now we will see what are the symptoms of this hepatitis B. Symptoms of hepatitis B. Hepatitis B, as the name indicates, it affects liver. It infects the liver. It causes liver infection. This liver infection, it may be of two types. One is known as acute hepatitis. Another is known as chronic hepatitis. This acute hepatitis, it is a severe and infection of short duration. Acute means of short duration. The infection may be very severe, but of very short duration. Chronic means long-lasting infection. So, what are the symptoms of acute hepatitis? In acute hepatitis, the person suffers from inflammation of liver. The person suffers from inflammation of liver. The liver of that infected person becomes enlarged, that becomes swollen, right? Inflamed. The person suffers from jaundice. Jaundice is a condition in which bilirubin pigment, when our erythrocytes are damaged, they release hemoglobin. Then that hemoglobin is broken into bilirubin and biliverdin pigment. This bilirubin is then excreted in urine. But in case of hepatitis B, liver fails to excrete this bilirubin. And this bilirubin pigment, it accumulates in body fluids. It accumulates in body tissues and turning the body fluids and body tissues yellowish in color. So the person develops a yellowish tinge. A person develops yellowish color. So this yellowish color of the body fluids, yellowish color of the skin, yellowish color of the eyelids, yellowish color of the nails, etc. Right? This is known as jaundice. So jaundice is a condition in which liver fails to excrete bilirubin pigment, and this bilirubin pigment, it accumulates in body fluids. Body fluids. From body fluids, it is then deposited in body tissues, and a yellowish tinge, a yellowish color is developed in all body tissues, and a person in chronic cases may become completely yellowish in color. It is also characterized by nausea. A person develops nausea, a person may suffer from vomiting, a person may suffer from abdominal pain. Abdominal pain is caused in acute hepatitis, right? A person may suffer from lack of appetite, and a person may feel tiredness or fatigue, right? So these are the symptoms of acute hepatitis. It rarely causes death. It rarely causes death. Death is not frequently associated with this acute hepatitis. So in acute hepatitis, a person suffers from inflammation of the liver. The liver of the person becomes swollen, right? The person may suffer from jaundice. Liver is not able, this inflamed liver, it is not able to get rid of this bilirubin pigment. And this bilirubin pigment, it accumulates in body fluids. And from body fluids, it is deposited in tissues. And it produces a yellowish color in the skin of the affected person, right? It, in acute hepatitis, the person suffers from nausea. The person suffers from vomiting. Nausea means feeling of that he is about to vomit, right? He develops some water in the mouth, watery secretion is in the mouth, and the person feels that he is about to vomit. Or sometimes vomiting may happen. The person suffers from abdominal pain because of inflamed liver. The person experiences pain in the abdomen. The person experiences lack of appetite. Appetite, desire for eating food is reduced. The person gets tired. The person feels lack of energy or fatigue. The person may get fatigued. And It rarely causes death. These are the symptoms of acute hepatitis. These are the symptoms of acute hepatitis. This acute hepatitis, it may produce a severe effect, but that effect is not long lasting. These symptoms then they resolve after some time, right? What is the case in chronic hepatitis? Chronic means long lasting infection. In chronic hepatitis, chronic means long lasting infection. Long lasting infection. In chronic hepatitis, a person suffers from permanent liver damage, causing liver cirrhosis. Liver cirrhosis. A person suffers from liver cirrhosis and liver cancer. Liver cancer. Ultimately causing death. Ultimately causing death to the suffering person. So, what is liver cirrhosis? Because of the viral infection, liver suffers damage. If liver is continuously and for a long period of time suffering damage, then liver loses the ability to replace its worn out cells. Then liver cannot repair its worn out cells. And those worn out cells, their position is taken by fibrous tissue or fatty tissue. So the liver shrinks in size. Liver shrinks in size because most of the liver is now occupied by scar tissue or fibrous tissue. So liver slowly loses its function. When the liver slowly loses its function, then the person may suffer from death. Or sometimes because of continuous damage to the liver, then liver cells they start dividing uncontrolled in an uncontrolled manner, and that causes liver cancer. So chronic hepatitis it is mostly associated with liver cirrhosis and liver cancer. Both of these conditions are very fatal; they lead to death. However, in acute hepatitis, there is short-term inflammation of the liver. Liver cells may get damaged, but those damaged cells may be replaced by new cells. For some time, the liver loses its ability to excrete out, to process this bilirubin pigment, and bilirubin pigment may accumulate in body fluids, and from body fluids, it may be deposited in body tissues. That causes the jaundice, yellowing of the body tissues. The person may suffer from vomiting, abdominal pain, right? Lack of appetite, fatigue, etc. But those symptoms they resolve within a specific period of time, and the person again feels normal. But in chronic hepatitis, the liver damage is permanent. That permanent liver damage, where the normal liver cells are replaced by scar tissue, that is known as liver cirrhosis, or the liver may suffer from cancer. And this liver cirrhosis and liver cancer, they are both the leading cause of death in chronic hepatitis, right? So symptoms may be acute or chronic. So acute symptoms they resolve within a specific period of time, and chronic hepatitis it finally leads to liver cirrhosis and liver cancer, and they finally cause death. So that is about the symptoms of hepatitis B. Then, what is the prevention of this hepatitis B? How we can prevent ourselves from this hepatitis B infection? So, as I told you, its mode of infection is just like AIDS. It is a sexually transmitted disease. So, if we avoid all those factors which lead to its transmission from an infected person to a normal person, then we may not contact this hepatitis B. So, prevention, prophylaxis, prevention. So we can prevent this hepatitis B by avoiding prostitution and homosexuality. We can prevent spread of hepatitis B by avoiding prostitution and homosexuality or making unprotected sexual intercourse. We may also prevent the spread of hepatitis B by making checked blood transfusions. At the time of blood transfusion, it must be seen, it must be ensured whether the blood which is to be transfused is hepatitis B negative, right? It is not from a person who is suffering from hepatitis B. Similarly, at the time of organ transplantation, it must be ensured that the organ donor was not hepatitis B positive, right? Similarly, at the time of this, at the time of artificial insemination, it must be ensured that the semen was not obtained from a hepatitis B patient, right? So, avoiding prostitution and avoiding contact with body fluids of already suffering person limits the spread of hepatitis B. And one must also make use of disposable syringes and needles because it also spreads from infected person to a normal person by sharing those disposable syringes and by sharing of those needles and syringes, right? So that is the prophylaxis. So if we avoid these things, right, if we make sure that body fluids are not exchanged between infected person and a normal person, then this hepatitis B spread can be controlled. Then there is another method of protecting a person from this hepatitis B, that is by vaccination. Various vaccines are available in the market for protecting the persons from hepatitis B. There is a vaccine that is known as Energix B vaccine. Energix B vaccine, Revac B vaccine, or Shinvac B vaccine. So we can control the spread of hepatitis B by immunization or vaccination, right? So if we get immunized for this hepatitis B by this Energix B, Revac B, or Shinvac B, then we are not likely to contact with this hepatitis B. So immunization of the people, it can limit the spread of the hepatitis B disease. Then therapy. This hepatitis B, it can be cured by proper treatment. So a person must be taken to the doctor, and doctor, according to his condition, will prescribe. A doctor will prescribe antiviral drugs. It can be treated by giving patient antiviral drugs. There are a lot of antiviral drugs available in the market, which has the full potential to treat this hepatitis B. So that is all about hepatitis B. It is causative agent, it is mode of infection, it is symptoms, it is prevention, and it is treatment, right? So that is all about hepatitis B. Now, after hepatitis B, we are going to discuss about another viral infection, that is common cold. This time we were discussing the diseases which are caused by viruses. So there is another common disease which occurs because of a virus, that is common cold. Common cold. This common cold, it is caused by a virus. It is causative agent is a virus belonging to a family of viruses known as rhinovirus. Rhinoviruses. So there is a group of viruses which are known as rhinoviruses. They are the causative agents of common cold. Rhino pertains to nasal chambers. Rhino pertains to nasal chambers. So these viruses, they attack the upper part of respiratory system, respiratory tract. They attack the nasal chambers. Mode of infection. How the virus is spread from one person to another person. This virus, it may be airborne, it may be it may spread from one person, infected person, to a normal person through droplet infection, or it may be fomite borne. fomite-borne. So we can contact the infection from an infected person through inhaled air. When an infected person sneezes, he releases a lot of small droplets of water in the air. Those droplets of water, they contain viruses. If these droplets are inhaled by some other person, so he will get infected. This mode of infection is known as droplet infection. This droplet infection is also found in COVID-19. In COVID-19, we are now asked to use masks so that we do not inhale droplets released by infected persons at the time of coughing, at the time of talking into the air, right? But common cold is also airborne. The virus may also be floating in the air. So if we inhale this air which contains floating viruses, that is also likely to cause disease. This is not true about COVID-19. COVID-19 doesn't remain in air, it drops down to the soil. But this common cold virus, it may float in the air. Or fomite-borne. Fomite-borne means which spreads through contact with personal belongings of a person. Suppose I am holding this pen in my hand. If I am suffering from common cold, when I will sneeze, the viruses may fall on this pen, right? If anyone holds this pen in his hand, he is likely to get the viruses, right? So fomite-borne means through personal belongings. Personal belongings. They include pens, notebooks, cups, hanky, clothes, towel, etc. So the virus may be present on the personal belongings of a person. If we touch those personal belongings of the infected person, then we may also get the infection, right? So mode of infection of common cold is it may be airborne, the virus may be floating in the air, we may inhale it along with the air. Droplet infection, when an infected person sneezes, he may release droplets of water in air. Those droplets contain the virus. Fomite-borne, these viruses may be present on the personal belongings, pens, these notebooks, hankies, combs, cups, clothes, etc. They may also contain the virus, right? So this is just mode of infection. Then what about its incubation period? Incubation period for common cold maybe a few hours or a few days, depending upon the immunity of a person. If a person has got a weak immune system, he may develop the infection within few hours after inhaling of the droplets from the infected person, right? So it depends upon the immune system. If the immune system is strong, then it may take longer time for manifestation of symptoms. If the immune system is weak, then the infection, the symptoms, they may be manifested within a few hours of infection, right? So incubation period for this common cold may be few hours to few days. Then what are the symptoms of this common cold? We often suffer from this common cold, particularly in cold seasons or sometimes during hot summer months. This is not a life-threatening situation. It just gives us some discomfort. Then after a few days, it's all of a sudden disappears. So it is not a life-threatening situation, common cold. Symptoms. The first symptom of common cold is burning sensation. Burning sensation in nasal chambers. In nasal chambers. The virus enters through the nostrils and resides in the nasal chambers. In the nasal chambers, it causes very burning sensation. Then the person starts sneezing. Then the person starts sneezing. It is followed by runny nose, runny nose, runny nose. Watery discharge starts flowing out from the nasal chambers. This may be followed by nasal congestion. Nasal congestion. After some time, our nasal chambers, they may get blocked permanently. They may get blocked temporarily, right? Thick viscous mucus accumulates in the nasal chambers. That is known as nasal congestion. A person may also feel irritation in his eyes. So that produces watery eyes. Produces watery eyes. The person feels excessive production of tears in the eyes because of the irritation of the eyes. A person may experience sore throat, or the person may experience hoarseness of voice. The voice changes. A person may experience coughing, coughing, or the person may experience tiredness or fatigue. So it is an upper respiratory tract infection. URTI, upper respiratory tract infection. Upper respiratory tract infection. So mostly the virus causes infection of the nasal chambers, sometimes the pharynx, or sometimes the larynx, right? So nasal chambers, pharynx, and larynx, they may be infected. So the symptoms start with burning sensation in the nasal chambers, followed by sneezing, followed by running nose, followed by nasal congestion. Some persons develop irritation of the eyes. They feel itchiness of the in the eyes, and they produce excessive tears, so they develop watery eyes. Person suffers from throat infection, sore throat. Some persons, they suffer the infection of larynx, so their voice changes. They may experience coughing, or they may experience tiredness or fatigue. The person, due to this infection, becomes exhausted. He gets tired or fatigued. So this is an upper respiratory tract infection. So this infection mostly affects the upper respiratory tract, starting from nose, pharynx, and larynx. Right. The infection remains for 3 to 7 days. These symptoms may remain for 3 to 7 days, and after 3 to 7 days, these symptoms, they suddenly disappear. They suddenly disappear, and the person feels normal again. So virus completes the cycle within 3 to 7 days, and after 3 to 7 days, these symptoms resolve, and the person again feels okay, right? So our immune system tackles the virus within these 3 to 7 days, right? So these are the symptoms of common cold. What is the prophylaxis of common cold? How can we prevent ourselves from getting this common cold? Prophylaxis. Prophylaxis. Prophylaxis means prevention. So if we want to save ourselves, from this common cold. So we must maintain a distance from an already suffering person. Maintain a distance from already suffering person. If we have a suffering person, if we have a suffering family member who has contracted common cold, so we must keep ourselves away from him. Or if he is in our close proximity, every time he sneezes, he should also cover his mouth and nose. Or if he doesn't cover his mouth and nose, then you should cover your mouth and nose, right? This already suffering person, he should be kept in isolation from rest of the family members. He should be kept away from the rest of the family members, because we don't know when he will sneeze or when he will cough or when he will talk. So whenever he talks, sneezes or coughs, he is releasing viruses in the atmospheric air, right? And anybody around him who inhales this atmospheric air is likely to get infected. So it is better to keep the suffering person away from the rest of the family members in a separate room, in isolation. Whenever we provide him food or tea or any other thing, his items should be then, his used items, they should be then sterilized. If you are providing food to this family member in a plate, he eats the food and now you are taking plate back from him. Immediately sterilize the plate, sterilize the cup, sterilize the glass, right? So the items used by this already suffering family member, his items should be sterilized. Then we are not likely to get the infection, right? So maintaining a distance from already suffering person, sterilizing his items which he has used, right? That also minimizes the chance of infection. Keeping him in isolation, that also minimizes the chance of infection. Covering your mouth and nose when anybody around you coughs or sneezes, that also minimizes the chance of infection, right? So these are some preventive measures. So if we take these precautions, then we are not likely to get the infection. And one should also avoid contact with dust and dirt, dust and dirt, because these viruses are also present in dust and dirt. So whenever anywhere dust flows, you should cover your mouth and nose, even eyes should be closed, so that these viruses along with this dust and dirt, they are not deposited into your eyes, nose or mouth, right? So avoiding contact with dust and dirt and avoiding contact with already suffering person will prevent you from getting the infection. Now, what is the treatment? As I told you, this common cold, its symptoms are resolved within 3 to 7 days automatically. Our immune system tackles the virus, and within 3 to 7 days, all the symptoms go away and a person gets cured. But sometimes there are apprehensions of secondary infection. Sometimes it may lead to infection of the lungs. In case of secondary infection, when lungs are involved, in case of secondary infection, when lungs are involved, then doctors prescribe antibiotics. Use of antibiotics is recommended. So for common cold, we don't need any antibiotics. Our immune system will tackle the virus within 3 to 7 days and all the symptoms will disappear. So this common cold is naturally cured by the help of our immune system within 3 to 7 days. But some persons who have the risk of getting the secondary infection, who have the risk of lung involvement, some persons they develop lung infections after suffering from common cold. So those persons who develop secondary infection, whose lungs get involved due to this common cold, they are recommended use of antibiotics. Antibiotics are not effective against the virus, but if secondary infections, when the mucus accumulates in the nasal chambers, or sometimes the mucus accumulates in the trachea, in that mucus then bacterial growth occurs, right? If there is bacterial growth, then we Then the doctors, they recommend antibiotics. If there is no bacterial growth, if there is no secondary infection, then antibiotics are not necessary to be taken, right? So that is all about this common cold. So we have discussed three viral infections: AIDS, hepatitis B, and common. Now we are going to discuss some infections caused by protozoans. There are certain infections which are caused by protozoans. Now we will discuss those protozoan infections. This is caused by protozoan. Protozoan disease. The first protozoan disease which we are going to discuss, the disease which is caused by protozoan, is amoebiasis. This amoebiasis, its causative agent is ant amoeba histolytica. Histolytica. So it is a protozoan parasite. Ant amoeba histolytica. This ant amoeba histolytica, a protozoan parasite, it causes the disease amoebiasis, right? So how does it enter into our body? What is mode of infection? Mode of infection. It is mode of infection is direct and oral. Direct and oral. Or we can say it has got feco-oral. Feco-oral. So a person ingests tetranucleate cystis. Tetranucleate cystis of Entamoeba histolytica along with contaminated food and water. Along with contaminated food and water. So we ingest the parasite directly through our mouth. So that is why we call it as direct and oral. The parasite, the pathogen enters into our body directly through our mouth, right? Along with contaminated food and water. The tetranucleate cysts of amoeba, they are present in the food, they may be present in the food or water, and they are ingested by the person. You know, when an already suffering person passes out his stools, in his stools, there are cysts of these tetranucleated cysts of amoeba histolytica. So when the fecal matter drops into water, these cysts are released in water. If anyone takes this contaminated water, he is likely to get infected. If the fecal matter dries up in open and houseflies and cockroaches pass over it, these cysts they stick to the legs of houseflies and cockroaches. And if these houseflies and cockroaches they sit on our eatables, then they transfer these cysts onto our food items. And if we eat that contaminated food, then we are likely to get this amoebiasis, right? So it is mode of infection is direct and oral, right? Or we can say it has got feco-oral route. Already suffering person releases cystis in his fecal matter, and from that fecal matter, vectors, houseflies, and cockroaches, they may transfer these cystis to our food items, or if the fecal matter falls in water and that water is inhaled by someone, then he is likely to get infected. Then what is it? It is incubation period. It is incubation period, maybe 2 to 4 weeks. Its incubation period is 2 to 4 weeks. Now we will see what are its symptoms. What are the symptoms of amoebiasis? As the cystis reach in our alimentary canal, these cystis, they release young amoebae. And these amoebae, they start releasing an enzyme. They release histolysin enzyme. Histolysin enzymes in our colon. These histolysin enzymes, they cause erosion of colon mucosa. Colon mucosa. They cause damage to mucous membrane of the colon. And our colon does not reabsorb water and mineral salts. So the person starts suffering from frequent diarrheas. The person develops frequent diarrheas. This colon mucosa, which is damaged, this mucus is released in stools. So mucus passes in stools. Mucus in stools. Whenever the person passes out stools, those stools are with mucus. And it may also cause ulceration of colon. So then causing hemorrhage. And this blood may be also present in stools. Blood may also pass in stools. So in amoebiasis, a person immediately suffers from frequent diarrheas. Why diarrheas? Because they damage the colon mucosa. These anti-amoebae, they release enzymes. Those enzymes erode colon mucosa. So colon is not able to reabsorb water and minerals from this undigested food materials. So because of failure of reabsorption of water and minerals, the person's stools become loose and he frequently passes out these stools. He suffers from diarrhea. In his stools, mucus is also present. Mucus also passes out in his stools. And sometimes the protozoans, they cause ulceration of colon mucosa. They damage the colon, walls of colon, muscles of colon are damaged, blood vessels of colon are damaged, and hemorrhages occur. And blood may also pass in stools. The person develops abdominal pain. A person develops abdominal pain. The person becomes restless, because just after 1 or 2 minutes he feels need for defecation, right? So he keeps on going to toilet and returning back, going to toilet and returning back. So he suffers from frequent diarrheas. So he becomes restless. A person may also suffer from nervousness. Due to discomfort, the person becomes nervous, right? So abdominal pain, restless, nervousness. The person may feel nausea. The person may feel nausea, right? The person may start vomiting. So these are some symptoms of this anti-amoeba histolytica infection, amoebiasis. So amoebiasis is most frequently characterized by frequent diarrheas. Mucus and blood may be found in the stools. The person develops abdominal pain, severe abdominal pain. The person becomes restless, and person also becomes nervous. The person may suffer from nervousness. The person feels nausea. The person starts vomiting, right? And the person gets weak. The person gets dehydrated because of loss of water, right? So these are the symptoms of amoebiasis. How we can prevent this amoebiasis? I think we are running out of time. This is section for today. We will discuss its prevention in the next lecture.